Welcome back. Now, it's not often that you meet someone who has a license to treat patients beneath the sheets, but our next guest does just that, and she's a leading sex therapist, and among her clients are Hollywood's most elite. She works with women, men, couples, and gender-diverse individuals on relationship and sexuality issues. Her biggest beef is with people who claim they are sex addicts. Very interesting. And we're obviously ramping up the conversation, so parents, you might want to send your little ones out of the room for the next 10 minutes as we welcome certified... She brought her kids and now they're gone. We welcome certified sex therapist Dr. Holly Richmond to the show. Welcome.
Welcome to the chat. We have a lot to talk about.
Yes, we do.
So you have on the right dress.
I do.
For sure.
Exactly.
We're ready to talk it up.
Yes,
okay, so first, how did you get into this line of work?
So I'll keep this as quick as possible. So when I went to get my master's in clinical psychology, you have to do 3,000 hours of internship to get licensed. So my internship placement, I chose the Santa Barbara Rape Crisis Center, which I know sounds sad, but it was really a pretty hopeful place. But after doing my internship there, I realized I was taught how to treat trauma, but I wasn't taught how to treat sex. So I said, I need to go get my PhD and my certification in sex therapy and help these people not just fix the trauma, what had happened, but fix, they want to be in relationships. They want to be having healthy relationships and healthy sex lives.
So you're a somatic psychologist and certified sex therapist, which is a rare pairing credential. So kind of tell us what is one and what is the other, and how do you use them together?
So the somatic psychologist, soma means body. So I pay as much attention to what's going on with my patient's body as I do with what's coming out of their mouth. So that can mean chronic pain. It can mean muscles that they're holding in different ways that are getting in the way of their having pleasure. So that's that piece. So even though I'm body, there's a component of the body that I work with, I still don't touch. So that's the main thing. It's like, what does a sex therapist do? I talk about sex, I think about sex, but I don't. There's no touching because I'm licensed as a therapist. And then the certified sex therapist, that's just another 350 hours of training, plus always CEs, learning everything about sex you can possibly imagine.
Really? What an awesome job. Oh my gosh. What an awesome job.
It is.
Speaking of, you must see some unusual cases. What's maybe the most unusual thing you've had to treat for?
So I was thinking about talking to you guys, and I'm just going to say it, and if we need to cut it.
No, you're good.
Just don't say the F word.
Right. No. So fetishes. I would say fetishes are the most interesting. Like, you know, I'm expecting foot fetish. I'm expecting leather fetish. What I'm not expecting is rubber gloves or tongues or elbows. So those are interesting. Yeah.
Wait, that's real? Like,
yeah.
I guess anything can kind of be a fetish because you can be fixated on anything.
Yep.
Right.
And those things I mentioned, not bad. I'm not making a judgment about it. It's just a little bit different.
Wow.
So now, how do you treat your clients? Do you treat them in your office? Is this a Skype thing? Do you...
all of the above. All of the above. So some I see, I still have a Southern California office, but I'm based in Portland right now. So I'm doing a lot of teletherapy, which some people like kind of the anonymity, like the survivors I've worked with, they tend to like just the phone. They don't, sometimes they're just not ready to be seen, and just being on the phone is more comfortable for them. My couples, I almost always do Skype or, you know, whatever app we want to use for that, because I need to see what's happening with them. I need to see their body language. It's so telling, and of course you get this when they're in your office, but when they're at their home, how close they're sitting to each other and what the body language is like when we open up the app and I'm seeing what's happening there.
So at what point would a couple come and see you? When do they need to?
Yeah, so for me, so they're going to look at me and say, okay, she's a certified sex therapist, so I almost always get the sex things. So the most typical is, we call it desire discrepancies, but what they're going to say is, I want to have sex, he doesn't, or I want to have more sex than she does. So I see a lot of sexless marriages, yeah, just couples not being on the same page for a number of reasons.
So my husband says that his number one thing, you know, if he said, if I was going to give a marriage seminar and I was going to go talk to a room full of women, I would say, just have more sex. And that makes for a good marriage. That would make for a good marriage. I mean, that would be his remedy is, you know,
end of story.
Yes, you know, but no, and I've already earlier in the show, we discussed that, you know, how it does add a pep in your step and it does create intimacy on stuff. There's a common ground there where you may not have common ground in the rest of your world.
But how true is that statement where it's like just,
Yeah.
And I
had
know,
sex,
I
you'd
know
be happier.
several marriages that have failed on this exact topic.
Yep.
And so what you do is so valuable. How do you get people on the same page?
So I literally give them homework. I set up a protocol for them. They have their homework every week. And to some extent, I think you're right. For a lot of men, and sometimes for women, like, it was interesting, 2016 was the year of couples coming in. It was the woman bringing the man and saying, he's not asking me for enough sex.
Wow,
So I was
now
thinking,
that's unusual.
I'll blame it on the eclipse.
yes.
Oh God.
No, but this was last year, and then so I was like, is this a tide change? Are women wanting sex more? And then 2017, it's been more men coming in and saying,
You're like,
hey,
well, that didn't
and
last very long.
there it goes. There was the wave.
Back to usual.
You know, in the intro, when Catalina was introing you in, she made a comment that you said something about sex addiction, that there's no such thing. I have never in life heard of that, so I need for you to explain that, sister, because I know a lot of people.
Enlighten us.
And we've had celebrities
Even
come out and
Tiger
say they
Woods.
are sex addicts. So why do you say that it's not a real thing?
Okay, so do you guys know the DSM? What the DSM is? It's the Diagnostic and Statistical Manual. That's how we diagnose. It is this big,
Wow.
and it's got all of our diagnoses, all of our codes in it. It came out, gosh, 2.5 years ago, the latest version, the 5. And the board talked about having sex addiction as a diagnosis, and they decided there's just not enough evidence to make that statement yet.
So you as a professional, how do you feel about that?
So here's the interesting thing. It's a lot of, when people say, oh, it's just semantics, it is in some ways semantics because I treat a lot of sexual compulsivity, but we have to be careful what we call it. So a man will come to me and say, I'm just watching too much porn and it's taking away from my relationship. So I absolutely treat that. But to call it a sex addiction, I think it's just a misnomer because then you're making it about the addiction. You can't really be addicted to something you're watching, right? Can we talk about porn? Can I just, say, okay, so you say you're watching too much porn. That's not a substance. You're not. If I take that away from you, you're not going to die.
Interesting.
It sounds to me like what you're saying is when it comes to sex, there's no normal.
Right.
Right. What would you say is just a normal look at a sex life?
No, you're right. Variance is normal. Variance is very normal.
As long as it's consensual.
Yes. And so my whole thing, my sex positive approach is all sex is good sex as long as it's consensual and pleasurable.
And that would be the normal.
Exactly.
All right.
Yes.
There
Well, thank you so much for coming. What a great conversation.
Definitely.
All right, well, stay with us. We'll be right back.